retinal surgeries are technically one of the most demanding surgeries in the field of ophthalmology. These involve intricate steps and have higher chances of intraoperative complications or unanticipated situations. Thus, imparting surgical training for these multi-layered surgeries is a big challenge. Observing competent surgeons perform these surgeries and then attempting directly onto the patients is the traditional approach. This not only compromises patient safety but increases surgery time and also the stress levels of the trainees, sometimes leading to sleepless nights. Wet lab practice on cadaveric eyes can improve the hand-eye coordination and give a basic orientation to tissue handling. But this has its own limitations such as availability and handling of these eyes, requirement of separate instrumentation which cannot be used further onto the patients. Simulators are a great tool in training the budding surgeons, but they are very expensive and available at few centers, especially in the developing countries. Recognizing the limitations of all these approaches, we designed a simple, cost-effective, practical eye model, RETISURGE, which would help beginners to acquire essential skills required for VR surgeries. Model eye is designed using 3D printing. An eyeball is sketched based on its anatomy, which is then incorporated into the CAD software with appropriate dimensions. The model consists of two hemispheres. The upper one is made up of flexible material, that is TPU, which has same tonicity as that of human sclera. The lower part is made up of PLA. Preparation of the retinal film. A colored printout sheet is folded into a hemisphere using the concept of cave comb wrapping. A 3D printed tracer is used to customize the fundus printout so that it fits perfectly into the eyeball model. For a realistic fundus image, we can print it on a PETG sheet and then shape with thermoforming technology. A microscope handle cover is fitted into a cardboard box with a hole in the center. The model eye is then placed over this assembly. Two ports which simulate the superior sclerotomies are made in the eyeball using the 23 gauge tricars. These ports allow the introduction of the instruments into the posterior segment. This assembly is then used in conjunction with the operating microscope fitted with the biome to visualize the posterior segment and practice various steps of VR surgery. The biggest advantage of our model is that it has been designed by using indigenous materials that are readily available in our hospital, making it inexpensive with a total cost of less than $5, whereas the commercial eye model kits cost more than $100. Secondly, it can be used for practice inside the operating room without the need for separate instrumentation, including the viewing system. But the most important aspects of VR surgery is the focusing and adjustment of the microscope to obtain an optimum view of the retina, especially the periphery. Beginners face a lot of trouble in this aspect, but it can be overcome with practice using this model. Manual dexterity is the basic skill required for all VR surgeries. This model helps the trainees to achieve the desired flexibility of the non-dominant hand required for performing bimanual maneuvers during these surgeries. RETISURGE can also be used to practice the basic component of core vitrectomy, that is illuminating the retina and the vitreous to be removed without losing the focus of the microscope. Endolaser can also be practiced on this PETG film. The burns resemble those on the human retina and the power settings are comparable with the real life scenario. Further, it helps beginners in developing the sense of awareness regarding the position of instruments inside the eye to avoid inadvertent complications like retinal touch. The trainees can then be assessed by a vitreoretinal surgeon on the basis of the above skills. Once they are competent to perform these steps on the model eye, they can then perform them on the patient. This decreases the anxiety level of the trainees, improves their proficiency in complex steps, avoid disastrous complications, and hence improve patient care. Thus, RETISURGE is a simple, economical, and reusable model in training the budding surgeons for VR surgeries.